Hi, everybody. My name is Jada Smith, and the name of my project is called Outbreak Communication. How often are you informed about the coronavirus, also known as COVID-19? Let's start with a little background information. So, as you can see here, the name coronavirus means it's a name for a large set of illnesses, including the common cold and other respiratory diseases. So, the coronavirus is known as a communicable respiratory disease. It is posed as a serious health risk, and the first case was reported on New Year's Eve 2019 in Wuhan, China. It got exposed in the United States from people who had traveled from China or Europe, and it is spread from respiratory droplets when we talk, sneeze, or cough. So here is a timeline of the pandemic. Like I stated before, the disease was first introduced in China on New Year's Eve, which was December 31st, 2019. So as the new year came around, WHO published their first disease outbreak news on the virus with no deaths in China. So at this time, there were no deaths included with the virus in China. So in January 13th, the first case of coronavirus outside of China happened in Thailand. On January 20th, WHO also issued a statement that there was evidence of human-to-human interaction. February 3rd came around, and WHO then released an international preparedness and response plan to help protect states with weaker immune systems. March 11th came around, and WHO declared that COVID-19 could be characterized as a pandemic. You may not know what WHO is, so WHO stands for the World Health Organization. They are very credible. So let's talk about effective communication during the pandemic. So communications must successfully inform and motivate appropriate self-protected behaviors. So with this means that communication needs to be updating risk information. We need to be able to trust officials, and we also need to ignore these rumors. So we all know that responses on influenza risk information is influenced by psychological, social, cultural, health, and socioeconomic factors. And with these things, it is greatly affected how people interpret health risk communication. Also, effective communication can prepare the public to adapt to changing circumstances. So here, examples of effective communication would be encouraging prevention, such as continuing to wash your hands, social markets and health promotion, building trust with our officials, like I stated before, and reporting recoveries instead of reporting the mortalities. Now, let's talk about the poor communication during this pandemic. As you know, as more cases rise, communication with vulnerable populations will change. So as you see, I have listed cultural values. According to Elaine Vaughn and Maureen Serfert, excuse me if I'm pronouncing their name wrong, but they stated that African Americans and many more low-income citizens are more likely to evaluate risk problems in decision options in terms of fairness, equality, and justice, which means this will create a more intense and durable emotional responses to health risks. Also, I have listed here the government agencies not speaking on one voice. This has caused a very chaotic thing for not all the government agencies to agree on what they should promote to the public. Also, I have listed that politicians are coming into conflict with scientists. So with that being said, politicians have they have presented mixed messages, resulting in confusion and wild behavior, such as people going to Florida and the California beaches, ignoring social distances. Also, I have listed here that the presidential and government communication. So President Trump stated that to save the economy, people might go back to work as early as Easter, which was the opposite of what the federal public health authorities suggested, that social distancing could and likely last for several months to keep the spread of diseases down. You know, President Trump gonna do what he want to do. Some solutions that we have here. One solution we could do is stop believing these misconceptions that have been presented all over the world. Next, plans should be made from the perspective of the target population. And finally, communication must be integrated. Now, here we have some misconceptions about COVID-19. Now, I didn't know anything about this until I looked it up, and I've been in a couple group chats. But some people really believe that the 5G towers are the reason that the virus have spread it so quickly. But I'm here to tell you that that is false. It's a myth. Viruses cannot travel on radio waves or mobile networks. The virus is only spread through respiratory droplets from coughing, sneezing, and speaking. The next misconception that we have here is UV disinfectant lamps can kill the virus. I don't know if people are buying those on Amazon. I hope not. But these lamps should not be used to sterilize hands or other areas on the skin. With that being said, I'm pretty sure UV lights can cause skin irritation and you can get like a bad burn or something from it, something like that. And then the final misconception that we have here is that spraying chlorine or alcohol all over my body can cause the virus. Okay. Spraying these substances on your body will not kill the virus that has already entered your body. I'm not sure what they're saying is if you don't have the virus, you can still spray your body with chlorine or alcohol, but according to who, they said that if you already have the virus, it's no point in you trying to spray your body with these substances. And also, if you may not know, both of these substances can be harmful to clothes and membranes. Is it froze again? Oh, there we go. So looking forward, this is what needs to be done, in my opinion. So the first thing that needs to be done is making realistic planning processes. So with that being said, we need to use telephone and internet-based advice lines to reduce the unnecessary visits to the hospital's emergency department. And also, we need to create a pandemic preparedness committee in the hospital or in any clinical place. Next, I have limiting the spread of the virus, which means we need to prevent staff from getting infected by training them on the use of personal protective equipment, and also prevent infected staff from working. If it's possible, I hope that they test all of the staff in the hospital before they try to interact with their patients. And finally, maintaining the workforce, which means vaccinating all the staff and also coming up with coordinated plans with other hospitals to recruit and use volunteers, just in case you may run out of staff due to the virus, or they may not want to come in because they're scared. Thank you for listening to my presentation. And once again, my name is Jada Smith, and I hope you have a blessed and nice day.